Public health is really about response and rapid response. Um, when one infectious disease after another was hitting, leaving a catastrophic scar on families, communities, and thousands were dying at a fast rate. It was the mixing of populations that were living in unsanitary conditions and working long and strenuous hours in unsafe work conditions at bed. The exposure to various diseases, bacteria, funguses that were being transported by cargo, carrying and breeding rats, animal feces, and or urine. It was all entry for disease, and there was no type of regulation. The things like yellow fever, smallpox, the bubonic plague, cholera, I hope I pronounced that correctly, and the influenza pandemics. Um, Something had to happen, something needed to be taken into effect, community action. We have something called the police of powers, and that is when the government or the state can actually step in for safety of the community and well-being of health worldwide. Things like quarantine, vaccination, which has all been proven to help and aid in some sort of containment, at least until things can be reassessed. And that is basically what public health is. So in 1973, Philadelphia had to be moved from the epicenter because of the yellow fever epidemic. It prompted the first Board of Health to come into effect, and that will be brought forth later on in my presentation. Several key determinants are broadly categorized into social, economic, and environmental behavioral factors. Understanding these determinants and what population that they most greatly affect is crucial for development of planning and implementation of health strategies for these people in the communities where they're born in, where they grow, where they work, where they live. It's part of them as a whole. Things such as lower educational levels, social economic connections and support, income, gender, and your culture, your ethnicity, all of these things go into social determinants. This slide, we're going to touch a bit on health equity, which is one of the most prevalent and important issues in public health. It is a fundamental, basic human right that everybody be given a fair chance to reach their fullest potential of health and have the same opportunities as the next person. There's been many advancements in vaccination, antibiotic breakthroughs, and even just drug research, disease research, and that is also increasing the life expectancy rates. Not everybody gets the same chance to access these new findings and these new rights, and that's what health equity is about. If you see in the picture, everybody's given a wall, and let's say maybe a baseball game is going on behind there. Well, it may not be a problem for some people to watch and enjoyment and have a good time and whatnot, but you also have a little guy on the very right. And even though he's given that opportunity, he just can't reach it. Education, employment, housing, the safety of the neighborhood that you live in and your surroundings, any traumatic life experiences that you may have had through your lifetime all influence a person's health. And poor health has been proven to be a result of these inequities. These inequities cannot be remedied by healthcare and medical alone. By following the love of Jesus and loving thy neighbors, you can dig deeper into the inadequacies. By advocating for the health system change, by satisfying the needs that are most deterring to these patients and educating in their communities. Advocacy in all areas of the healthcare policy is needed. Whether you're working in a hospital, a clinic, a community center, a public health school, um, any type of facility, the desire to see individuals achieve their highest potential of well-being and health as a whole is the ultimate goal. Some examples of poverty, racism, inadequate housing, access to safety centers or clean water, access to even healthcare, somewhere that can be met for needs, say vision, hearing, any type of thing, instead of going to overcrowded emergency rooms. There needs to be some type of stable healthcare system, as in doctor visits and things like that. But the effect on the lifespan and longevity is what is affected the most. Jesus often heals people physically, opposed to removing obstacles that they may encounter in their social structure that may disadvantage them. But demonstrating this love can be done inside and outside of the healthcare system. And it's almost like a assistant to him in your doings. So you know that United States spends the absolute most money on healthcare. Yet we rank last out of all the developed countries. We also have the highest infant mortality rate, which is quite alarming. That's due to lack of prenatal care, lack of being able to get healthy foods. Although we've made some strides really with promotion and public health and informing the public, that has increased. But the infant mortality rate still remains high. There was, according to an article, in 2021, 8.6% of the US population was uninsured. And this is according to the WHO, the WHO. Affordability remains at one of the top reasons why Americans do not have health insurance. The high out-of-pocket costs, and half the working age adults either skip or delay treatment or needed service or checkups because of the cost. We are one of the only countries not doing the universal health care. So everybody is just a free for all on their own. Yet, you may have access to some type of health care, but you're limited as to what you can receive. And that's a lot of the reason why, too. The rules of government and public health are very important. They enforce laws such as quarantine, mandatory vaccinations, anything of the sort, just to keep the public that much more healthy, to inform. A lot of the non-governmental agencies like the Cancer Society or Diabetes Society, there's many of them. This is to inform the population of a particular chronic disease, to give information on how to manage or control it and even prevention of it. It's providing information, and it's just rational decision making, and policy development in the community. It's alignment of the policy and enforcement of the policy as well. And that is the governmental role in public health. Public health may involve protecting individuals, communities, or an entire population. These three core functions are crucial and they are the Achieving of Public Health Goals, which is abbreviated EPHF, which stands for the Essentials of Public Health Function. Together, these three core foundations work to restore, improve, and promote, and to protect public health, most importantly, to ensure the accessibility to these services. The evolution of public health is a continual process. As pathogens change, so do environments and so do hosts. And this is continually happening in the world around us. Communal habitation is essential to the adaptation of changing environments, and that's allowing for growth and also for expansion